Yep, well, certainly plenty of tennis to be had. We've been talking a lot about how important the strength and conditioning and the nutrition aspect is. And I actually got a chance to catch up with a couple of the doctors, orthopedic surgeons, who are on site tending to those athletes. Let's take a lesson. Welcome to Doc Talk, presented by Mount Sinai. Joining me right now, Dr. Shawn Anthony, as well as Dr. James Gladstone, both orthopedic surgeons specializing in sports medicine, and also one of 4 orthopedic surgeons who are on site here throughout the entire tournament. That sounds like quite the gig, or responsibility, I should say. Now, is this your first U.S. Open, Dr. Anthony?
I've been covering now for 4 years.
Okay. And how about you, Dr. Gladstone?
For 7 years.
And do you, either one of you play tennis?
I started about 5 years old. I started playing tennis.
Okay, so you're a veteran. You've been here before. And how about you, Dr. Gladstone?
I do, but not very well.
Okay, not very well. Well, we're not judging you. This is all about being a great tennis fan.
Yeah.
So just some general questions for a lot of the tennis fans who are watching out there. What's a great and also healthy way to prepare themselves to play tennis?
Yeah, preparation for tennis starts way before you get onto the court. I tell players to think about 4 things. One is getting a good night's sleep. Rest helps the brain and the body recover from the previous day and be prepared to be at the peak potential function for the match. Second thing is nutrition, eating a good carb diet in the hours before the match and then refueling with protein afterwards. Dynamic stretching is really important. Jumping jacks, running in place are all great ways to get blood flow to the muscles to try to help warm them up and prevent injuries. And then 4th is hydration. Players can lose 2 to 3 liters of water an hour, so it's really important to drink both pre-match as well as during the match.
It's funny because 20 years ago when I was playing tennis, we would do static stretching, which is where you hold the pose for about 30 seconds. But today it's very different, where you hold the pose for 2 to 3 seconds because that's supposed to maximize your muscle performance, I guess. You could probably explain it much better. And Dr. Gladstone, what makes coming to this tournament and being part of the staff so exciting or special for you?
Oh, well, the atmosphere, I think, is electrifying. You know, once it gets going, starting tomorrow, the grounds are full, the stands are full, everybody's excited, the players are all pumped up. When you listen to interviews with any of the players who play here, they always say that this is probably the best, most exciting of the Grand Slam tournaments. So just being a part of it is wonderful.
And Dr. Anthony, you talked about some of the basics for novices to get into the sport. As you become more advanced and elite, what are some of the other things that you need to do in terms of really making sure your body is prepared for that pounding?
I think one of the things that separates a novice from the elite player is the year-round preparation. Tennis involves, tennis serves, forehands, backhands, involves a lot of stress on the shoulder and elbow, hips and knees. So being prepared and building up the right muscle strength year-round helps you be ready for the match.
Dr. Gladstone, do you notice any sort of trends in terms of a specific type of injury that's really prevalent among tennis players today?
I think particularly amongst the weekend warriors, it's shoulder problems. Because most people sit behind the desk all week long, then they go out, they really want to use their energy, get going, and they don't warm up properly. They haven't done anything during the week, and they just set themselves up for problems.
So how could they avoid that?
I think it's not difficult. I think during the week, spend even 15, 20 minutes, maybe twice a week, doing some good stretching, doing some basic strengthening. Even things just like sit-ups, push-ups, riding a stationary bike, running on a treadmill a little bit. I mean, one, it's healthy for you, period. But also, it gets you going and it gets the muscles ready for when you get out there on the court.
So we certainly see a lot of injuries with the weekend warriors. I've seen that with a lot of my friends. But what about the professional tennis players? Are there any specific type of injuries that you are really seeing at this point forward? I've heard maybe wrist, a little hip.
Yeah. I think most of what we see, fortunately, aren't catastrophic injuries. Every once in a while there are, but most of them are overuse injuries, and particularly the shoulder and the wrist and the knee.
Now, can you tell us a little bit about your responsibilities here? Are you called to attend every injury timeout?
So there's always a orthopedic surgeon on site covering the players at US Open. So we're courtside for any acute injuries that happen. We work very closely with the physios who know the players well since they travel with them.
And do you have any other? Do you have any MRI imaging system on site just in case something pretty severe happens?
So we have ultrasounds on site, we
Okay.
have a radiologist on site, we have x-ray machine on site, and we have MRI nearby. We can get that at a moment's notice.
Well, that's very
So,
much needed.
yeah.
That's a lot more helpful than having to go all the way back to Manhattan, and before you know it, an hour has passed by.
No.
Now, would you have any tips for a lot of the fans out there who might be dealing with an injury themselves? How do they themselves get back on the court? Dr. Anthony?
I think it's really important to seek out the help of either a sports medicine specialist or orthopedic surgeon to take a look at those injuries. Trying to push through pain will only make the small tear larger or injury worse. So it's important to seek the help of a professional early on.
Dr. Gladstone, any last minute tips?
I really agree with Shawn. I think one of the things is trying to understand what's serious and what isn't serious.
Yeah.
So something that doesn't go away in 2 or 3 days, you got to take seriously, and you really don't want to push through pain. I think that's probably the dumbest thing you can do because you end up with something worse.
You gotta listen to the body. You gotta listen to
Absolutely,
the body.
yeah.
The whole adage of no pain, no gain, that's kind of old school. You really want to listen to your body. I think we have some questions from our Twitterverse. I believe I've asked enough questions today. You're tired of hearing from me, but there is one from Mr. Jeff Glick, and he was asking something about nagging injuries. As someone who loves to play tennis every weekend, how do I keep those nagging injuries away that seem to crop up as I get older? So the older and the aging component is very important here. What kind of advice would you have?
So I think one thing to remember is as we get older, everything gets stiffer. So I think stretching, and we talked earlier, dynamic versus static. I think general stretching is good as you get older. I mean, if we just take one example, a guy like Novak Djokovic,
Yep.
I think one of the reasons he stays in such great shape and is able to do the things he does is that he's incredibly flexible.
Yep.
When you see him out on the court, he'll roll his ankle and then be able to keep playing. And that's because he's well prepared, he's good and flexible beforehand. So I think we got to remember we get stiffer, and so do some good stretching, and not just before you get out on the court. All year long.
Yeah, you
during
don't
the
want to come
week.
out there and do it for 5 minutes, and then you're like, oh, I'm
Absolutely.
good. That's not stretching.
No, the thing, your lats, your hamstrings, everything, your lower back. I mean, everything's prone to injury.
That sounds okay. So flexibility. And Dr. Anthony, anything else?
I would just add total body conditioning. Players often think that their strong forehand comes from a big biceps muscle. It's actually the core muscles. So thinking about the other parts of the body that may not first come to mind to gain strength. So total body conditioning, upper body, lower body, as well as core.
Total body conditioning, flexibility, I'm on it. I'm thinking about all those things. Dr. Gladstone and Dr. Anthony, thank you so much for joining us, and that will do it for Doc Talk.